Hey, do you know that most of the heart attacks can be prevented by modifying your risk factors? Most of them are preventable. So let's talk about that. What are the risk factors for heart attack, myocardial infarction? Um, One is non-modifiable. You cannot change anything about it. For example, age. Risk increases with age. Men more than 45, women more than 55. Sex, men, they are at higher risk earlier, and women, they catch up after menopause. Family history. So if you have a premature coronary artery disease in first degree relatives, that's a high risk. Genetics, certain lipid disorder, clotting disorder, those are risk factors which are non-modifiable, can change. When modifiable, you can change them, and that's high blood pressure, hypertension needs to be controlled, high cholesterol, especially high LDL and low HDL and high triglyceride, that needs to be managed, controlled. Diabetes, insulin resistance, that can be modified with lifestyle changes. Smoking, definitely. Obesity, especially central obesity, abdominal fat, visceral fat, they are directly related with the coronary artery disease incidence. Sedentary lifestyle, lack of exercise. So get up, move around, walk every day. Unhealthy diet, high in saturated fat, trans fat, high salt, sugar, processed food, they are dangerous for you. Chronic stress and poor sleep, that can also be modified. Alcohol excess, that's also a modifiable risk factor. And there are some emerging additional risk factor which needs to be considered. Chronic kidney disease is directly related with the increased incidence of coronary artery disease. So is inflammatory condition like rheumatoid arthritis and lupus, and high lipoprotein A, sleep apnea, air pollution exposure. So those are modifiable risk factors. Um, so how to prevent a heart attack? Lifestyle measures, healthy diet, Mediterranean style diet, fruits, vegetables, whole grain, legumes, lean protein, fish, poultry, healthy fat, olive oil, nuts, seeds, limiting sugar intake, salt intake, and red and processed meats and food. That's very, very important. Regular exercise. So 30 minutes of walking minimum, um, 5 days a week would do it. Moderate activity, brisk walking, cycling, or 75 minutes of vigorous exercise every week. Weight management, keep your BMI close to 25, and waist circumference less than 40 um, in men and less than 35 in women. That would be very, very helpful. Quit smoking, even one cigarette a day increases risk. And thing is that quitting drops this risk dramatically. Limit alcohol, no more than one drink a day for women and no more than two drinks a day for men. Ideally, you don't need alcohol basically. Stress reduction and sleep. Adequate sleep, 7 to 8 hours. Meditation, yoga, any relaxation technique, breathing exercise, tai chi, and anything you can do is going to help you. And it got to be part of your routine. It's not about doing a few months and then forgetting it. It's got to be part of your holistic lifestyle. Medical measures, control your blood pressure. It should be less than 130/80. Control cholesterol, statin or other therapy. Control diabetes. A1C individualized, but usually in between 6.5 to 7. Preventive medication, aspirin and statin needs to be taken if you have high risk, and talk to a doctor. Basically, I'm just trying to empower all of you with information. Of course, I'm not your doctor, but I'm the YouTuber or a TikToker who is trying to spread um, to people what I know little, and spread some love to people. I love doing that. But you need to definitely speak to your doctor, get into all the details, and find out what's your risk factor. There's some online tools as well, you can use it. But in short, heart attack prevention is about controlling your risk factors you can change: diet, exercise, blood pressure, cholesterol management, diabetes control, stress reduction, quitting smoking, and those would be, in summary, what you should be looking for. Some things you cannot change: age, genetics, family history, but you can definitely change blood pressure, high cholesterol, diabetes, smoking, obesity, stress, and lack of exercise. Eat healthy diet, more fruits, vegetables, seeds and nuts, and lean protein, whole grain, and healthy fat, polyunsaturated fat. Exercising 30 minutes a day, 5 days a week at least, and quitting smoking, controlling blood pressure, cholesterol, managing your stress. Remember, control what you can. Okay, that's how you beat the odds and protect your heart. Okay, so thank you for watching, and I appreciate you guys for following me and communicating with me. But remember that I'm not your doctor. Your doctor is, your doctor. But I'm here, and my purpose is to empower you with some information. Of course, I cannot provide every information I have, but with limited time and the video with my work, I try to come up with topics I think which relates to most of the people, and so that you can do your own search on internet and educate yourself about it, or talk to your doctor. So thank you for watching. I really appreciate it.